Hello, hello, all those beautiful faces. I'm Stephanie Edmonds. Welcome to Teaching Liberty. To live free, you have to think free. And that is exactly what we do here on this show. And tonight is, is, this story is a tragedy. It is crazy and it is a tragedy. And I have so much respect for this mother for telling the story and for I met her up at in Albany at a medical freedom rally. So tonight we are going to be discussing the medical industry, medical malpractice and um and really just like advocacy in general. She's gonna tell her story and we're gonna get really into some dark stuff here about what goes on in the medical industry and specifically something that, we're told we're not supposed to talk about, organ harvesting. It is a $50 billion, perhaps more year in industry because it operates both like in the legal realm, but then there's like a whole illegal thing as well. But yeah, we're gonna get into all that tonight. So appreciate you for checking in. Make sure you hit that like button. If you're new, subscribe. We go live like this every Monday night, talking to different people about different issues, historical and current. Hear their stories, talk about what's going on in the world. So welcome and thank you so much, Helena, for joining me here tonight.
Thank you for having me.
And so we met up in
So I
Albany
am gonna
and
start talking.
oh, yeah, I was just gonna cue you up a little bit more, like, we met up in Albany, and you were telling me your
Mhm.
daughter's story, and I was I really wanna hear the story, like, I'm up in Albany to go talk to some, of the senators, and I had some meetings I had to get to, and I was doing some filming, so I was like, "Alright, come on my podcast, and let's talk more, and I wanna learn more about your daughter's story." And the reason why you were up in Albany and the things that you're advocating for. So thank you and yeah, please tell us your story and the things that people need to know out there.
So I'm gonna start about my daughter, who she actually was. My daughter was 34-year-old when this happened to her. It happened in Hawaii, in Honolulu, in the largest hospital in Hawaii, in Queens Medical Center. My daughter was schooled in Canada, and then she was in Key West in the high school and in professional children's school in New York. She became a model. She was fashion model between year 1997 and 2002. Then she went to Boston University, where she studied international relationship. When she came back to New York, she was taking some acting classes, and she was multilingual. She was a very good downhill skier. She was an avid traveler. My daughter in 2012, she had decided to relocate to Hawaii. In the fall of beginning of fall of 2012, she had an accident. She was walking in high heel shoes and she twisted her left ankle, and she had a fracture between 2012 and 2015. She had to have two revisions on her left ankle. And during that time, she was visiting the Waikiki Health Clinic, which is like a walking clinic. And in 2013, she was visiting that clinic, and there was a physician assistant was taking care of her. Her care was just normal. Following year in 2014, she was also visiting the same clinic, and she was taken care of by nurse practitioner. Also, the care was perfect. But in 2015, something went wrong. She was taken care of by Dr. Ahora Payam, and he started prescribing very weird medications for her: opioids, antidepressants, sleeping medications. And I would called my doctor and I said, you cannot take that stuff. This is wild. This is bizarre what's going on. And because I'm a nurse myself with many years of experience, and so I was telling her not to take that. Um, 2018, 2018, when I filed the lawsuit, Dr. Ahorapayam had left Hawaii. He resigned from his position. But I was looking what position he held. He was a director of that clinic, and he also was the internist at Queen's Medical Center. So the hospital I am suing. So he most likely was profiling patients outside already in the field, because to this clinic, the people who to this clinic were primarily kids, surfers, homeless people, tourists. You know, it
Like,
was just a walk-in
transient.
clinic.
Yeah.
So in 20, yes, exactly. And so on December, in fall of 2015, Bianca developed like a skin redness on her leg, and it was a small area, maybe size of the grapefruit. It was just the skin redness. And she went to the clinic and she was ordered Kiflex and Bactrim, two different antibiotics back to back. And those antibiotics made her nauseous. She was vomiting. She got progressively dehydrated and weak. So her roommate would call, he would call the ambulance. And when ambulance came, it was on November 28, 2015. She was taken to the hospital, but at that time when ambulance came, there were three paramedics, two males and one female. And the female apparently was asking which hospital is familiar with Bianca. And Bianca had revisions done in the Stroud Hospital. She was never before to Queens. And so the a female paramedic, she had very concerned look on her face. She had to take her twins. When we did the depose the paramedics later on, when I was already in the process of the lawsuit, they never provided the female paramedic, only two males, coincidentally. So Bianca was brought to the emergency room on that evening, late afternoon,
So
like around 12 p.m.
they took her to the
in
emergency room
on December
of
20.
the they took her to the emergency room of the hospital she said she wasn't familiar with.
Yes, yes. She probably was in that hospital once before, like that was not the hospital she would go to. And so she was in the emergency room. At that point, I spoke to her. I have called her, and she was fully alert, attentive. Everything was okay. She knew who I am. She knew who she was. She knew what was happening and everything. And so they left her in that emergency room for 9.5 hours. And then conveniently, they transported her to ICU. There is a protocol and policies in every hospital that the patient who is ill has to go to ICU, has to be transported within 2 hours. They left her parked in emergency room for 9.5 hours. She was admitted to ICU with diagnosis of sepsis, which she never had. It was ruled out later on that she never had a sepsis. She had no temperatures. All her microbiology throughout the whole hospitalization was negative, and the skin redness has healed within 4 or 5 days or so. And so they needed some type of diagnosis which would bring her to the ICU setting. Her actual diagnosis was hypotension, which is low blood pressure due to dehydration. She was dehydrated. And but they were never addressing the diagnosis. Want her to progressively go downhill, because if you become dehydrated and you do not address this diagnosis, you don't rehydrate the patient, the volume is very low in your circulatory system and your blood pressure will progressively fall. It will be lower and lower. So she was brought to ICU, and prior she was brought to ICU, her medical record reads that and she did not require any critical care while she was in emergency room. So why was this patient brought to ICU? That's the question. So following morning, about at 7 o'clock, they did urine drug screen on her. And her drug screen came back highly positive for opiates. It can happen for two reasons. Either somebody gave her some additional medication in the time frame between the ambulance pickup and the urine collection, or her test also could have by the dehydration status, because she was on morphine at home, only PRN for the pain in that left ankle, which was ordered also by Dr. Ahora Payam in the clinic. But she was barely using that, so I had really that somebody added something to her in between, because she has an IV, it's very easy to do so. So that morning, then the urine test was sent at 7 a.m. At 8 o'clock, the nurse is assessing her, and she documents in her assessment that the patient has no pain. And also the results from the urine test come back at the same time at 8 a.m. and show there is a high level of opiates in her urine. But instead of telling the physician, this patient is already hypotensive, has very low blood pressure, we need, if Narcan, we need to reverse the situation, she is injecting the patient with fentanyl, which is causing more hypotension, respiratory depression. So later on, around 11 o'clock in the morning, there is one of the residents who was also on the procedure team, and he had decided to place the central venous catheter in her, which is also invasive procedure. There was no consent for that. There was no timeout. He was not supervised. Now, going back to her admission, they had never requested the consent be signed, admission consent to be signed by Bianca. She was fully alert and oriented, like you and me. She could have easily signed a consent. And something like that equals to medical kidnapping. That's not, it's not done. That has never been done in my nursing practice. At 12:45, they made an order for protocol, which is called alcohol withdrawal protocol, which Bianca would have 2 glasses of wine here and then. So they thought that she might go to alcohol withdrawal, which has never happened. She did not, but they call, because protocol has another good medication for them to use, which is Ativan. In protocol, there is a score which is called SIVA score, which assesses the patient's mentation. That was never done. They were never checking the score for 28 hours. And you have to check the score if you want to administer this Ativan. You're administering the dose of Ativan according to the score. And the nurse goes again, and she chooses the higher dose of Ativan, 2 milligram injectable Ativan, to give to the patient for the score which has to be 15 and above. But she never does SIVA score. She never checks the score. She never documents. She is never questioned by the nurse who follow Bianca. as their physician attending patients, why administering this active? Why did she administer fentanyl to this patient? Who patient claims, and I have no pain, and you giving, I'm hypotensive, I have very low blood pressure, and you giving me this fentanyl. So later on, that day Bianca was visited also by her roommate. Her roommate called her at 11 o'clock in the morning, and he asked her, "What would you like me to bring for you?" So she told him whatever she wanted, and he comes to visit her in the mid of afternoon. Also, the same day, her dad calls her from Europe, and he calls her around like maybe Hawaii time, and Bianca apparently started, and she was telling him that she's scared. My daughter traveled half of abroad on her own, and she never was scared. And she's in the hospital, and she's scared. Obviously, something was said in front of her, and she was not in medical field, but people don't have to be in medical field to realize that there is something going on around them. And so later on, her friend came to visit her in the afternoon. They placed the catheter. The resident who was placing the catheter around 11 o'clock, he stabbed her a few times. He was not able to place it. He was doing it unsupervised, without the timeout, without the consent, and he perforated her carotid artery. While he perforated the carotid artery, if there's something like that happen, you have to surgery for assessment. You have to do ultrasound to see if there is any hematoma developing inside. That was never done also. That he called nurse practitioner. Nurse practitioner was able to place the catheter. Even though Bianca did not need that catheter, she had peripheral IVs working. So why are you placing catheter on this patient? And so they place it, and after you place a catheter like that, you have to do chest X-ray. You have to know where the tip of the catheter is located. So the chest X-ray was done, and the radiologist had noticed that the tip of the catheter is way too deep in the right proximal atrium and need to be retracted. Because if you leave the tip of the catheter in the right proximal atrium, you're going to have a lots of problems. You're going to have a blood clots, you can perforate the atrium, you can have dysrhythmias, leading to shortness of breath again, but they just simply left it there and start using the catheter. You cannot do that. So about days later, on January 9, after Bianca was already in the coma and unresponsive, and she went into cardiovascular shock, one of the physicians went and retracted the catheter and hid his documentation, because if you do any invasive procedure or even the retraction, you have to document it as a note, not as a evaluation note, just regular note. And he hid his documentation in his regular note. So in that afternoon also on 29, they placed the feeding tube in Bianca. Bianca no need to feed. And if she could eat, drink, that's like completely ridiculous. And it was apparently placed by written order of one of the physicians. I went through the medical record. I could not find that order. That order is not there. That was all lie. And so between 7 p.m. and 8 p.m. in that evening, Bianca was on, they had her on 2 liters of oxygen at 7 p.m. And within that hour, her apparently has changed, that her oxygen demand has increased from 2 liters via nasal cannula had increased to 10 liters via oxygen mask. But if something happens like that to the patient, the physician has to come. They have to do variety of tests, primarily like ABG, arterial blood gases. They have to do EKG. You have to know what is happening now with this patient, that this patient has such an increase for oxygen.
Right.
Nothing
And
was done,
so
nothing is documented.
it's thing after thing
There
after
has
thing that is, like, adding up and adding up. And
mm-hmm,
so do you think that
adding up. Yeah.
right, do you think that these are all just a bunch of mistakes and this hospital is just really bad? Is there are these people purposely doing they're all working together? Is there one person who's, I don't know, doing the mistakes, and then everybody else is just reacting to those things, like, w w how is this happening? Like, how I had my son in a hospital and he was injured in birth, and I definitely see where mistakes were
Mm-hmm.
made, but
Yeah.
it's like it was like just it was really just like kind of like it it wasn't mistake after mistake after mistake after mistake. Like I can this seems like a little bit ridiculous. What's going on
Yeah.
here?
Yeah. These are more like detrimental mistakes. It's not just this, something that you would give somebody, let's say, instead of Tylenol, you give them Colace by mistake. That
Right.
not happens. These are mistakes which all leading to the deterioration of the patient. And there must be some intent behind it. You're doing this deliberately. This cannot be, you cannot. Um, so then what has happened at 8 p.m., there was no any documentation why she had such a demand for the oxygen suddenly within this hour. At 8 p.m., the nurse Nelson, who was her because nurse that into the night, she testified during the deposition that Dr. Ho came to her and he told her that he will be intubating this patient within an hour. And then when he writes his note after he intubated Bianca, he documented that this was an emergent intubation. No, there is no such emergent intubation. Emergent intubation is here now. It's not in 1 hour. During the deposition of Nurse Nelson, whom we have to look for in Alaska, she canceled about 5 depositions. Then we finally were able to find California for deposition. She testified that this was elective intubation. She was right about that this patient. So did respiratory therapist documented in her note that she was called to assist with elective intubation. Why do we electively intubating patients in ICU? No, there is no such a thing.
Right.
Patients are electively intubated only for general surgery when you have to give general anesthesia. This is the only time when patients are electively intubated. There is no any ICU intubate the patients. So prior you intubate somebody, you have to do what's EKG, anterior blood gases. You have to determine, do I really need to intubate this patient? Can the patient just do very well on oxygen, or maybe a non-invasive intubation like BiPAP, CPAP? That was never done. Also, they just intubated her. When you intubate, then you have to do another ABG, 30 to 60 minutes post-intubation to do ABG to make sure that the setting on the ventilator machine is appropriate for this patient. This was also not done. Instead, they take her out of the ICU for a routine test to radiology. Patients from ICU are never taken for a routine test. Machines are brought to them, and if they have to go for emergent test, then they are accompanied by the huge team. You need a physician to go with them, you need a nurse, you need a respiratory therapist to accompany them, because that patient is on portable ventilator, have medications running. Somebody has to be with them. The care during the transport has to be equivalent to their patient is receiving in the ICU. And that was not done. So what has happened going back to the intubation? During the intubation, you give certain medications. Bianca received etomidate, is one of the sedatives which is given during the intubation. And etomidate is out of your body very quickly, within 15 minutes is out. Then they gave her 2 milligram of Versed. Nurse decided on that she gives 2 milligram of Versed because that's another sedative. 2 milligram is nothing. It's out of your body kind of quickly. But they gave her rocuronium. Rocuronium is the paralytic agent. And because she was dehydrated, it's gonna stay. It can stay in the body up to 1 hour, and sometimes longer if the patient is dehydrated. And if you give rocuronium, you have to actually start sedation drip on the patient. That's never done. So now they remove her 22 minutes later, post intubation to radiology for a routine test. During the position, we have questioned Nurse Nelson, who accompanied Bianca, because there is nowhere note in her record. All the other transports are documented, except this one is not documented. We questioned her during the deposition who went with her, and she said it was her, which she lied, because later on we look into audit trail and we have seen that this nurse never accompanied Bianca, but she was on the 4th floor going through the computer. So she lied. She never went with Bianca. We asked her what was done. It was a CT of head, which is not true. Bianca did not have CT of head. She had a CT of left ankle, pelvis, and abdomen. It was completely unnecessary. And so we never could find out. She said when she lied that she went with Bianca, we asked her who was other person who accompanied Bianca. And she said it was he. She never gave us the name, who the person. So we assume it could have been either a respiratory therapist or it could have been escort person. You can never send a patient out like that from ICU. So now we're looking at the point when Bianca was brought to the radiology. I also blame radiologists. If I was to be a radiology technician and they will me a patient there who is stable ventilator, just intubated and have medications going and everything, and there is no doctor patient, there is no nurse, I would immediately call hospital administration. I would not deal. Something, what has happened to Bianca has happened in the radiology. It was done away from the floor, from the ICU unit, so nobody see what's going on. So when they finally brought her back to ICU, another hour they waited, and then they did her ABGs, and her two partial oxygen came back at 47. So that's very low. Norm is 80 to 100, and for ICU patient, we can accept above 65. So we don't know for how long she was deprived of the oxygen. At that point, she was in the coma. She was unresponsive. But the same nurse who assessed her at 8 o'clock in the evening, who documented that Bianca has clear speech, she's oriented ×2, she is slightly confused and thrashing in the bed, instead of reassessing the patient who is now in the coma and unresponsive, she is copy forward her note. So you cannot copy forward. You cannot say that the patient has a clear speech because patient is in the coma now, unresponsive, and is not talking because she has ET tube. She cannot talk to you. So this is what was going on. And so this leaves meanwhile, the doctor who was responsible for her, Dr. Ho, he actually during the trial, he was asked what are his specialty. And he says, we know that he is the transplantation surgeon, he is the general surgery surgeon, and he is also critical care physician. But he conveniently omitted transplantation surgery during trial when he was asked. After we have deposed him way before the trial, what he'd done, he had a practice in Hawaii. And he permanently, immediately after the deposition, with a few weeks, closed his 20-year-old practice, gets himself licensed in 28 states within 1 year time span, and he's out of Hawaii. This is a bizarre paper. So when they brought Bianca back also, he was the one, because her PO2 was low, so he increases the PEEP, which is the on the ventilator. And it cannot be done also because PEEP is partial and expiratory pressure. And usually we start the patient on he increases PEEP to 10. Bianca was already very hypotensive with low blood pressure. And if you are increasing PEEP like that, you have to have a patient on vasopressors. Because this increase in the PEEP causes decrease in cardiac output, and you have to have a patient on the vasopressor. Bianca was not on vasopressor drip. Then that's what they were doing with COVID patients also. They were doing the PEEP at 12, and that's the problem. So what has happened later on, they brought her back, then her nurse left at 3 a.m., which is also very odd. I've been nurse for so many years, nurses don't leave in the middle of the night, they're sick. Another nurse comes on duty, and she documents correctly. She documented that she is not able to assess the patient because she received the patient in the coma and unresponsive. And we can have a patient in the coma or unresponsive only for two reasons. Either brain injury or the sedation drip. No sedation drip. There was no sedation drip running. So she sustained a brain injury. Then following morning, they finally started sedation drip on her. And when you give sedation drip, you have to have a vasopressors because her blood pressure was already very low. It was like 70 over 40. They started vasopressor Precedex drip, which is the sedation drip, at 8:30 in the morning, and by 10 a.m. her blood pressure was 60 over something. And they left her for 2.5 hours to defer herself before her first vasopressor was started on her day to admission after the admission to the ICU with hypotension, which is complete. It's bizarre. It's like I have never seen this in all my nursing practice. I have never seen anything like that. And then she was some occasions we were giving her such a massive doses of Versed is sedative, very heavy sedative used primarily in operating room, and the maximum dose what you can give patient of her weight and everything would be about 360 milligrams within 24 hours. They were dosing with 600 milligrams.
Wow.
Um, before she died, about a week before she died, I have found out that was found later on from her X-rays. There was a fracture to her brain, a fourth right posterior. We can fracture the ribs, but it would be only anteriorly when we would do CPR on the patient. That can happen, but this was posterior. That would be only from some kind of blunt trauma. She also sustained heart attack, even though her EKG, echocardiogram in emergency room when she entered the hospital was completely normal. About a week prior she died, the chief of ICU comes one day, I was there, and he asked me if I'm ready to take her back to New York with me. And he also leaves and he comes back with the printout on rat lungworm disease and trying to bullshit me that my daughter has rat lungworm disease. Yep. Yeah. Yeah. In
So
2018, when I filed the lawsuit, CEO of the hospital resigned, CEO of Legacy of Life resigned, Director of Department of Health resigned. I had going on with Director of Department of Health because I have requested the investigative survey into the hospital, which was staged, was never done. There is a lots of conflicts of interest in Hawaii between the chief of ICU, who is sitting on the committees for Department of Health. Then it was medical examiner who was sitting on Legacy of Life, which is the organ donation. One of the neurologists who was coming to hospital visit Bianca was also sitting on the Legacy of Life advisory committee. You don't want me to start this.
no, I get
I don't know
no,
what to say.
it's starting to, like, get to my question, right? Like, I asked the question, like, "Well, who's responsible? Like, what's going on here?" But, obviously, it's impossible to say exactly what is
Mhm,
going on here, but when you start to triangulate some of the different people and the positions and the way that, eh, all
mhm,
everything was just
mhm.
accident after accident or whatever, like, just a deteriorating
Mhm.
status,
Yeah.
yeah, you start to get a picture of how something like this could possibly happen, and it's hard for good people who would never would think, "Oh, if
Yeah.
somebody's hurt, a hospital helps them," right? Like, there's nobody there that was gonna hurt you, that would do it on purpose. Like, yeah, sometimes
Yeah. Yeah.
accidents happen, but, like, to think that there are people out there who are plotting on people in order to have financial gain, and so the lifetime legacy company, just to be clear, is the organ donation company, and so what's being alleged is that there
Mhm,
is, like, a conspiracy to provide organs, right, to this company, which operates in some ways
mhm.
legally, right? There's a
Yeah.
legal organ market for donating organs or
Mhm. Yes.
but they do illegal
Mhm.
things to ensure that there is a supply, and you're alleging that your daughter was part of
Yes.
one of these rings. Not part of it, she was victim of one of these rings.
Mhm. Yes, we have to realize that we what many people are familiar with, what many people we are number one transplantation country in the world. It's not China. China is second actually, and this information was presented by Dr. Damon from DAFOH. DAFOH is the organization Doctors Against Forced Organ Harvesting, and he presented this information. I always thought it's China. No, it's not China, it's us. And we know where China gets their organs from the massive side. And the question now is, where are our organs coming from to make such a profit, almost $50 billion? That was in 2020. Now it's probably even more. Where do we get these organs? We also have to take into consideration the matching, because it's 1 out of 10 people would be can match. So it's a massive amount of organs. Where do we get these things?
Yeah, I again, like, this
So,
is an interesting organization. I'd be interested to, like, read more into it. I mean, you've sent me a bunch of resources too, then I've gone down some crazy rabbit holes. Again, these are the things that I feel like, oh, like Q conspiracies, like a lot of the sexual,
mhm,
child trafficking, right? A lot of people say,
yes,
"Okay, yeah,
yes.
that's a thing," and, they'll know sometimes the numbers are high, but then when, like, you actually hear about, like, just, like, good people, they don't think this way, and so, a lot of times
Mhm,
because we don't
mhm,
think this way, we
mhm.
just
And also
block it
another,
out.
mhm. I think many people cannot accept the reality, they cannot accept the truth, and because it's really harsh truth. It's not nice, it's not something to talk about organ harvesting. That's not nice thing. And people been lied to. People been lied to for a half a century now, since late 60s. Can you please donate your organs and to help another 8 people or whatever? So they believe that they can give organs after they are dead, but we cannot have your organs after you are dead. They have to be viable. uh, Within 3 minutes, 3 to 5 minutes after the death, there is a decomposition starts, and those organs are not viable. So actually, the way how we get them, be alive. And we paralyzed you. We put you on the ventilator. We cannot put the dead man on the ventilator because it would not work. So you are actually alive. We don't give you any sedative. We paralyzed you and we cut you open. And we are removing one organ after the other. Heart goes last because we need the blood to the other organs to keep them viable. So this is the way how it's done. So this is not nice
Yeah,
thing
on
actually.
my license, I do know that, I have people in law enforcement, and they're like, "Oh, yeah, like, don't join the organ registry, like, don't click yes on there because if they won't try as hard to save
Yes.
you," right? I've heard multiple people in law enforcement, like fire,
Say,
paramedic, like, say
mhm,
that type of thing, and so, like, I don't know if it's true or not, like, I would hope
mhm,
it's
yeah,
not really
yeah,
true, like, that they really do, but, just to I
yeah.
also too don't
Mhm.
like yeah, like, I think there's a lot of I don't know, informed consent issues around medicine in general, so I just renewed my license, and I did not check the
Mhm.
organ donation registry.
Donation. Yes, yeah. No, it's yeah. So this is what is being done to the patients, and I don't
So,
agree with
where's your
organ harvesting.
lawsuit?
I simply we did not have it before 1960. So the law stands this way. I went through the trial in November of 2022, and we I didn't win. Judgment is vacated now, and I have moved a lawsuit to appellate court in California, but I am going to file another lawsuit. The first lawsuit is medical malpractice. This is going to be different. This is going to be about the fraud of illegal organ harvesting. And actually, everything is illegal. It's covered by our federal government, who is complicit is the legal system, medical system, and our federal government. And yeah, it is,
And
that's the
so
way
are
how
you
it started. When you look at the beginning of this organ.
Yeah, I was just gonna
Mhm.
say, are you doing this all on your own?
Oh,
Is there, like, a group that you're working with? Like, do you have to fly out to Hawaii in order to
I
do
have
this?
yes. Well, first, how I originally started when this happened to my daughter, I had the attorney with whom I was working working. And about 6 weeks before the statute of limitation was about to expire in 2018, from one day to the next, he said, I cannot take the case, even though it's very, very strong case. And I believe he was threatened. I truly believe he was threatened because at that point I was already up in the hospital of this organ harvesting. And then I started pro se. I did not the statute of limitation to expire. I had friends help me to draft the complaint and all this stuff. And I did, I believe, first two hearings on my own against four defense lawyers. And I did quite well. I had a very good judge. I was very satisfied with my judge. And yeah, so, and then I found the lawyers I have had. Well, what ended up at the end, I don't think my lawyer working really with me. They were working with somebody, but definitely not with me. Because there was an occasion during the end of the trial when there is the closing arguments, and the defense lawyer was lying to jury about the sedation. He that Bianca, my daughter, was in the coma and unresponsive because she was receiving sedation drip, which is not true. Because the nurse documented that Bianca was in the coma unresponsive at 4 a.m. The first sedation was not started until 8:30 in the morning. So I was telling Mommy, who's sitting next to me, I said, object. You need to object. We have discussed it. And he would not. So at that point, I already know. This is it. And there was another defendant. I cannot talk about it because it's in the sealed documents. There are two transcripts from the trial, which are sealed. And what has happened, also the judge whom I had, I was very pleased with the judge. Actually, he was a chief judge in the federal court. And right after this trial, he was moved to the position of regular judge. Before the trial started, he called me the night before, and they were looking for me, so I had to go back on the Zoom. And he asked me, Miss Krizek, have you accused hospital organ harvesting? And I said, yes, I did. I can say no, but I don't lie. Yes, I did, and I will continue to do so because I have evidence. Because my daughter's body was returned to the organs. And I did not know at the time when the funeral was done, when we did cremation, I have requested autopsy right after she died. And I did not get the autopsy result until after cremation was done. And so once cremation was done, 3 weeks later, I have received autopsy result. And I am looking at autopsy result, and all the organs were anatomically disposed, meaning sold. You cannot use them for transplantation, but you can use them for research, education, and other venues. And there is a big business with organs, not only for transplantation, for other things also. And so they returned me the body without the eyes and without the organs.
Wow, no
So I have
eyes.
evidence. If I was to wanted to fly her, yes, well, her eyelids were glued, so you couldn't open. They glue them.
Okay.
And so what has happened? If I wanted to have second opinion autopsy, I could not have done it because if I was to fly the body somewhere else for privacy, and they would open the body, and there is nothing to examine. The
Right.
organs are all gone. They took all the organs from thoracic cavity and from abdominal cavity. And so this judge called me in the night before the trial, and did you accuse them? Yes, I cannot deny that, and I will continue to do so. I am
And
not
so why
leaving
did
them
that judge
alone
call you though? Like,
because
why
what
would
has
that
happened to my
judge
daughter.
why would that judge
He
Yeah,
Because
why
the
does that
defense
matter?
had reported,
For doing what though? Like,
yeah,
reported you for
defense
what?
had reported me to that I am accusing the hospital of illegal organ harvesting.
And you're not allowed to do that? Like, you can't have
And
your free
so, yeah,
speech
I
to
am
accuse
not
them of
gonna
that?
deny the free speech. We don't know about that now. That's another venue.
I just don't understand why it matters, like,
We
to the
know the free
case if
speech
you
now.
said that they're organ harvesting, like, I just don't understand why it matters, it's so weird.
Mhm.
Well, so okay, so you're about to
Yeah, yeah, no,
refile, a
it's
different case,
yeah.
a medical malpractice case, um, I mean,
Mm-hmm.
is there any other I know you were up at the Capitol, advocating for medical freedom, sort of generally against some of the bills that they have going on there. Are there any other,
Mm-hmm.
ways that you are, trying to get justice for your daughter or, uphold her legacy, or any ways that we can support you and help you?
I am considering I have a book already. Book is written, but it has to be published. Somebody wrote the book for me, but we are looking for the publisher.
Okay.
So I don't know how we be able to publish, if they will even take something like that, because this is going against the whole industry of organ harvesting, and this is a very powerful industry.
Right. Yeah, I mean,
So we
the
don't
whole
know.
medical industry.
Hopefully, we are looking for the publisher. So maybe if we can even publish this on Amazon, like self-publish, we will see.
Yeah.
You know, so that would be one of the things. And I would like to think about the maybe or something like that. That possibly, but I will lawsuit. I'm definitely going against the whole industry. I believe this is all wrong, what is being done. My daughter is not the only one who perished in that hospital and in any other hospitals. Because when we look at 50 years time span, millions.
Yeah, medical malpractice is one of the top causes of death. It's not the number one. I think heart disease is the number one cause of death.
Yeah,
But medical malpractice is, like, way up there. Um,
but
and, so, yeah, this is
mhm,
definitely a serious problem just even on the medical malpractice side, and then the other more sinister
mhm,
aspect of it is the organ
mhm,
side of it, whether it's for research, for transplants.
yes,
People and we know just in general, they're
yes,
trying to collapse consent around medical issues, whether it's for children, getting, vaccines or different medical procedures or different
mhm,
prescriptions for medications, and then for adults trying to
yes,
collect on medical
mhm,
information or say, like, if you don't take this jab, you're gonna lose your job. So, these are issues everybody needs to be aware of. You need to ask
yes,
questions. You need to look out for each other. Like, don't go into medical facilities by yourself. Like, bring a partner, bring somebody who can
mhm,
be there, who can help advocate for you, who can, keep an extra eye out. And
for you,
definitely,
yes.
Helena, please keep us updated
Mhm,
on any lawsuits that you file or anything else that we should know about.
mhm. I am I am sorry, I'm still waiting for the result from the appellate court, but this would be about that first medical malpractice lawsuit. The reason why I filed it to have the trial bring back to Hawaii for a retrial. When I went into this first time, if I knew now if I would do it over again, I would just speak up without my lawyers, completely ignore them and bring the trial into mistrial. I would not have to go through the appellate court now. If I was to do it immediately when, for example, when the defense lawyer was lying to jury during the closing argument, if I would stand up and object, I would immediately bring this trial into mistrial, and I would not have to go through this nonsense going all the way to appellate court and whatever. We
Oh,
learn as we go. I am not
yes,
the
we
attorney, I'm a nurse, so
definitely, we learn
I
as we
know
go.
medical stuff, but
um, and hopefully others can learn from your
mhm.
story and we'll be following along, we'll be praying for you and yeah, thank you so much for coming on and telling your daughter's story and really opening my eyes to something that I hadn't really thought 2 seconds thinking about. So, yeah, I appreciate you. Thank you everybody who came through and checked in. I know some of the
Thank you
sound
very
was a
much
little
for
bit.
having.
Yeah, yeah, definitely. And, we'll be back here next week, next
Yeah.
Monday night. Hopefully, I'll have
Mhm.
another video out between now and then. So remember, if you didn't hit it on the way in, hit that like button, subscribe if you're just finding your way here. And remember, think free, live free, and give all the glory to God. Until next time.